Okay, everybody. Hello, Ashley, are we good to go?
Yes, we're good to go.
Alrighty.
Hold on. Let me make sure cable is ready. I'm sorry, Councilmember, this Marquez.
No problem, Marcus. I can wait.
Councilmember, cable is ready.
Great. Thank you.
Okay, bye-bye.
All right. Good afternoon. I'd like to call this meeting to order. Today is Friday, May 9th, 2025. The time is 12:35 p.m. This is an additional meeting of the Committee on Health, and we're holding this meeting virtually. I'm at-large Councilmember Christina Henderson, Chair of the committee. I've been joined by, oh, we almost have near perfect attendance. Councilmember Zachary Parker from Ward 5, Councilmember Charles Allen from Ward 6, and Councilmember Brianna Doe from Ward 1. Today, we will consider and vote on one measure before the committee, Bill 26-109, the Farmers Market Support Amendment Act of 2025. Bill 26-109 was introduced this January by myself, along with council members Allen, Fruman, Nadeau, Parker, and Robert White. It was referred to the Committee on Health. We held a public hearing on this bill on March 17th, 2025, where we heard from farmers market operators and food policy advocates from across the district. We also heard testimony from DC Health and received written testimony from the Department of Licensing and Consumer Protection, as well as the Department of Transportation and the Department of Parks and Recreation. All are involved in the licensing and permitting of farmers markets in the district. Farmers markets are essential for increasing access to healthy and affordable food and supporting small farmers and district small businesses. There are currently 53 independent operated DC farmers markets across all 8 wards, and almost all of the DC farmers markets accept federal and local food assistance benefits. In FY 2024, over 10,000 district residents spent 1.5 million in produce plus benefits, $500,000 in senior farmers market nutrition benefits, and a little over $32,000. No, sorry, $322,000 on women, infant, and children farmers market nutrition benefits to purchase fresh fruits and vegetables at all of these farmers markets. We know that the purchase of the fresh fruits and vegetables have direct benefits on health outcomes. Diet related to chronic diseases such as type 2 diabetes and heart disease are prevalent in the district and are disproportionately affect our low-income residents and Black and Latino residents. The physicians at United Medical Center told me last year that 40% of their admitted patients were experiencing diabetes as a co-occurring condition. 40%. As one farmer operator testified at the hearing, you either pay the farmers or you pay the doctors. Farmers markets can play a key role in expanding healthy food access in low access areas. Many neighborhoods in the district do not have access to healthy food, with approximately 330,000 residents living in an area classified as a low food access. Despite significant investments, the district has struggled to open full service grocery stores in these neighborhoods. And while we certainly will continue these efforts, farmers markets are a quicker, low cost strategy that can be a part of the solution for increasing access. In addition to increasing food access, farmers markets are a critical revenue source for our regional farmers. At the public hearing, we heard from a risk management advisor and former Homeland Security and Emergency Management Agency employee who testified to the who testified about the disruptions, the national and global food supply chain, and how that would affect DC and disproportionately affect low food access areas. He testified saying, quote, encouraging greater local food production can help with disruptions. He also voiced strong support for this legislation. We heard loud and clear at the public hearing that this is a process, that the process of becoming licensed and permitted to operate in the district is complicated and burdensome. I think many of you didn't know that you needed up to 13 different agencies to have approvals in order for a farmers market to operate in DC. Market operators testified about the challenges, including delaying opening day due to stalled permit approvals, paying architects for traffic control plans, even when the market operates on a sidewalk, and much more. This legislation takes several critical steps to encourage farmers markets to open, operate, and expand across the district. These include, first, establishing a farmers market support program within the Department of Health to provide technical assistance to markets, provide guidance on licensing and permitting, and to coordinate across agencies to support farmers markets. It also creates a grant program of at least $250,000 to incentivize farmers markets to open and expand in low food access areas by funding operational costs, infrastructure, and year-round operations. This waives all of the licensing and permitting fees for farmers markets, farm stands, and mobile markets that are operating in low food access areas. It requires the district to create a centralized application process for farmers markets by January of 2028. This system would enable farmers market operators to submit their application to one government agency through an online portal. The portal will then make the application available to the other relevant agencies to review and clearly communicate to the applicants the status of their application. And finally, the committee print also makes some small changes to the Statewide Health Coordinating Council, also known as the SHIC, that DC Health requested after the passage of the Certificate of Need Improvement Amendment Act that this committee has already acted on. The SHIC is currently a 15-seat board with a chronically high vacancy rate. Following recommendations by DC Health, the bill reduces the SHIC from 15 to 9 seats, and all of the seats are being, just so anyone's wondering, all of the seats that we are cutting are currently vacant, so we're not taking anybody off the board. I will note that this bill is subject to appropriations. The Office of the Chief Financial Officer reports that it will cost about $669,000 in FY26 and $1.8 million over the financial plan. This includes one FTE, which, as you guys know, we get charged FTE for everything, and the cost of the program at DC Health, and then also for the technology build-out cost for DLCP, which makes sense. I'm proud of the progress we're making in this bill to acknowledge the critical role that farmers markets play in promoting health, increasing food access, and promoting a resilient regional food system. With that, I open the floor to discussion. Councilmember Nadeau.
Madam Chair, thank you so much for all your hard work on this. We have a number of farmers markets in Ward 1 that I know will benefit from it. And nutrition is a cornerstone of health, with food deserts continuing to persist in the district and holding us back from achieving our health goals for the community. I really do want to applaud you and your team for navigating the complex licensing structure and getting the agencies to agree on a streamlined and centralized process to reduce administrative burdens. It's not an easy task. I have some concerns about changes the committee's made that create a parallel licensing system to that already exists with street vendors, and how this might duplicate efforts and complicate the licensing process for both the vendors and the markets. So I'm going to vote today with you in support of the legislation, but I'm hoping we can work together before first reading to just sort of address some of those concerns.
Thank you. Certainly happy to talk further.
Thank you.
Don't want to complicate things further. Councilmember Parker.
Thank you. I too want to thank you and your team's work for this. I was proud to co-introduce it. I sit on the Council of Governments Farm Committee, and I know the committee weighed in formally endorsing this bill because it addresses one of our key strategies of expanding food access across the district and the region. I'm also really excited about this bill because Ward 5 is home to a popular farmers market, and there was uncertainty about registration and who do you go to and who has the rights to it. And this person says they have the rights, and this person says they have the rights. And so hopefully this bill expands clarity while also expanding food access. And so thank you again for your work on this. And I think it's going to help a lot of people across our district.
Thank you, Councilmember Parker. Councilmember Allen, I don't want you to feel left out nor obligated to say anything.
Yeah, I feel a little left out. Thank you for your work on this. In Ward 6, we love our farmers markets. We've got a lot of them. And in particular, they are places that families of all sizes, of all ages, of all incomes find fresh food. And so they are highly, highly successful. I also love farmers markets because in addition to, of course, providing this important space where people can get fresh food, they also are a place where community and neighbors gather. And so it is a great place for us to create and build community constantly with our farmers market. And again, just stroll through any one of them in Ward 6, or I'm sure some other wards have great farmers markets too. And you'll see your whole city there. You see young and old, you see just the beauty and diversity that is our city wandering through those, picking out what they like. So thank you for the hard work on this. I know there were some earlier issues I think that DDOT had worked with you and your team on, to my understanding, those have all been kind of worked out. So from my committee hat perspective, I think that we're in great shape and appreciate your work on that. So kudos and look forward to supporting this today.
Thank you. Yes, we got all of the agencies in a room to talk about all of the various issues. And surprisingly, you know, DDOT makes sense. We have some agencies that are involved in farmers markets that you wouldn't think would be, that needed to come to the table as well. So I
just realized, can I ask one question?
Sure.
I applaud it. I saw when I was reading through the FIS that apparently DOH says they need to hire one additional person, which feels like progress because every other thing says they need to hire 2 people. So the fact that we've got it down to now we just have to create a whole new position, even though I'm fairly certain we have some vacancies that exist. Kudos for knocking that in half.
It's like only half the tax.
Thank you. We're going to continue to work on it. No, but I am excited about the work that DC Health can do with this. And then also that we can finally have a single sort of point person for someone who might be interested in starting a farmer's market in their community, of helping to give them the technical assistance to be able to walk through that process, which right now you kind of have to sort of fly blind. All right, with that, I now move the draft report in print for Bill 26-109 with leave for staff to make technical changes. All in favor, please say aye.
Aye.
Great. Let the record reflect that the ayes have it and the measure passes unanimously. This concludes today's committee meeting. The council expects the mayor to transmit the FY26 proposed budget this month. And we'll be sharing the public hearing calendar as soon as it's finalized. We have no further business before the committee. The time is 12:46 and this meeting is adjourned. Thank you, everyone.
Thank you.